In this video, I'll walk you through what a chest CT is and how to understand the main parts of your report. A chest CT, short for computed tomography, is a fast, painless, non-invasive imaging test that uses X-rays and a computer to create detailed pictures of your lungs, heart, blood vessels, and other structures in your chest. Your healthcare provider may order it to look for the cause of symptoms like cough, shortness of breath, chest pain, or fever, or to monitor certain conditions over time. Radiology reports are written for medical professionals so they can include technical terms that may be unfamiliar. My goal is to explain the key parts of your report in clear, everyday language so that you feel informed and confident when you discuss the results with your doctor. A typical chest CT has several sections. History explains why the scan was done. Comparison tells you if there are older scans to compare with. Technique describes how the scan was performed and whether intravenous contrast was used. Contrast is a special dye injected into a vein that helps highlight blood vessels and certain tissues. Findings is the detailed description of what the radiologist sees. Impression is the summary, the bottom line, with the most important results and any recommendations. In the findings section, the radiologist reviews several parts of your chest. In the lungs, we look for nodules, small spots that are often harmless but may need follow-up. Consolidation or opacity, areas that look wider than normal, which could be due to infection, inflammation, or fluid. And atelectasis, a small area of collapsed lung, which is often temporary and not harmful. In the airways, we check for narrowing, thickening, or mucus that can affect airflow. In the pleura, the thin lining around the lungs, we look for pleural effusion, fluid between the lung and the chest wall, and pneumothorax, air in that space, which can cause the lung to collapse.
In the mediastinum, the central area containing the heart, large blood vessels, and lymph nodes, we may note cardiomegaly, an enlarged heart, aneurysm, enlargement or bulge of the aorta, the large artery taking blood away from the heart, and lymphadenopathy, enlarged lymph nodes, which sometimes need follow-up. We also review the bones of the chest wall and spine, where reports may mention common age-related changes like mild degenerative findings that often are due to arthritis. If you have medical devices, such as a pacemaker, catheter, or chest port, we confirm their position.
The impression section is the summary of what matters most. If everything looks normal, it may say something like no acute cardiopulmonary process or normal chest CT. If there are findings, the impression pulls them together in plain terms and may recommend follow-up imaging test, lab tests, or a visit with a specialist. Sometimes we describe something that may or may not be urgent, but may need to be checked out. This is called an incidental finding. Your doctor can explain whether any recommendation or recommended follow-up is routine or time-sensitive. A few tips as you review your report. First, look at the history and impression before diving into the full findings. That gives you the context and the bottom line. Second, if the report mentions prior exams, know whether or not the findings are new, stable, or improved. Stable or improved is often very reassuring and may not need any follow-up. Third, don't be alarmed by medical terms such as abnormal. Many findings sound serious but are common and not dangerous. Remember, your radiology report is written for your healthcare provider, but you have the right to see it and understand it. Write down your questions and talk to your doctor or ask if you can speak with the radiologist. We're here to help you make sense of your results and decide on next steps together. For more information about chest CT, visit radiologyinfo.org. Thank you.